Every single phone call, the question is asked, what if my loved one says no? And the answer is they're going to at some point through the recovery journey. And when they get the treatment and they detoxify and they start feeling better physically, but not mentally, they're possibly going to try to leave treatment against medical advice. What do we do at that point? Most of our clients are there living on family resources, or the family on some level has significant influence. Remember, if we got them to treatment through the intervention, the same principles apply to keep them in treatment. And a lot of people get scared at this, and we've taught many treatment centers this philosophy. And although you won't find this in any evidence-based textbooks, and I don't mean to be derogatory, but asphalt therapy is by far and wide the greatest tool we have. If they want to leave treatment against medical advice, it's because they believe that you're going to take them back in, or they're going to come back prematurely and wreak havoc back on your lives. It is a selfish act. They're thinking of nobody other than themselves. They're only thinking about what they need to do with utter disregard for you. So in our curriculum, when people try to leave against medical advice, we would get in front of that by expressing to you what our suggestions are of how you should handle it in collaboration with the treatment center. It's one of the main reasons people hire us, for that support afterwards. So if they try to leave treatment against medical advice, we have to talk out what is your leverage. You don't buy them the airline ticket, you don't go pick them up, and you set the hard boundaries. And you go back to the intervention of when you wrote out a consequence letter, and there's your no. What if they say no? Here it is. They didn't say no at the intervention. Now they're saying no to continuing treatment. And we have to get in front of it between treatment staff and our staff and you, so everybody's on the same page, because we as a group are far stronger than your loved one as an individual, and them wanting to leave treatment against medical advice is just them wanting to come home and drink or use drugs or go back to acting out their mental health. And it's not when somebody leaves treatment, it's how they leave treatment. And if that's what they're doing, those are the very same behaviors that led them to alcoholism. They're not sober, they're abstinent, they're currently dry, and we have to hold them accountable. And here's one last thing. When somebody tries to leave treatment against medical advice, and I could say this with absolute certainty with over 20 years of experience, when they do that, and the family holds boundaries, and they do go back, and they have been beaten into a state of reasonableness that they are no longer running the show, they end up becoming the best clients in that facility, and their rates of success for long-term sobriety significantly increase.